One question we're frequently asked is what to do about male breast enlargement. Now, male breast enlargement is called gynecomastia. It's just a redundancy of both fatty tissue and glandular tissue of the breast area. It also can involve extra skin too. And it kind of depends on which parts are most of what treatment method is necessary. Now, in general, if it's mostly fatty tissue that's the problem and there's not a lot of glandular tissue and the skin isn't too redundant, we can actually use a liposuction type technique to take care of that, in which we just make a little stab incision kind of along the axillary line down in the lower part of the breast and use that to vacuum away that extra fatty tissue. And then we put you into a supportive garment that helps to contract that skin to match that new contour. Now, if you have a little more glandular component to that tissue, we can't vacuum it all away. It just won't suction because it's too tough. And so in that situation, we make an incision right around the border of the nipple on the lower part and actually core out that extra tissue, remove it, and then again, we're allowing the tissue to shrink to match that new contour, and so we can't have too much skin. And with that technique, there's kind of an open pocket underneath there when we're done. So we do have to put a drain tube in to allow fluid not to build up there and cause problems healing. Now, if your problem is a little more severe, where you have both extra glandular tissue, extra fat, and extra skin, if that skin kind of folds on itself, then we have to do a much more involved technique where we actually cut away kind of a wedge of skin and fatty tissue and glandular tissue. We kind of reposition the nipple and end up with a scar that goes along the fold of the breast and then right around the nipple area where it comes back through the tissue there. Obviously that's a little bigger surgery, a little bigger recuperation, but if that's what you need to get the contour right, it's worth the scars. It basically depends on what your personal problems are going into it, which method we have to use to correct it.